Hey, do you ever feel like you can't relax? Like can't just breathe and let everything go? Well, that's what can happen with adult, but you know what? If you're young, a lot of those symptoms and conditions get diagnosed as attention deficit disorder, or attention deficit hyperactivity disorder. And if it's not in your mind, like it can literally go to your muscles. And now you have what's called restless leg syndrome. Well, did you know that there's a critical vitamin that can really help with both of those? Help with getting the blood vessels that go to the nerves to open up and relax. And they call it lipotrophic B vitamins, or the old school terminology for that is to call it vitamin G. Now, what vitamin G is really good for? Hyperactivity, nerve regeneration, restless leg, numbness, and hypertension. And really, it's packed full of what's called choline and inositol. So when we talk about choline, what it is really important for brain and liver function, metabolism. It's not technically a B vitamin, but it's always kind of roped into the B vitamin category. And it's important for your brain, for your liver function, and it protects the cell membrane, the skin around the cell. And so it's so good for nerve protection. You can even start thinking of peripheral neuropathy, and that can happen in your feet. But what if it goes the other way? Really can be part of the eye problems. The other thing that we talk about is what is another one of those is inositol, which is really important for blood sugar regulation. Those two vitamins together, I've just seen some really neat outcomes for helping people relax, helping people to beat and reduce restless leg syndrome. And in kids, it really has a nice, soothing, calming effect on all those impulses going through the brain that in traditional allopathic medicine may get the diagnosis of attention deficit disorder. Now, if you're liking this right now, I'm excited to share with you our free event that's coming up tomorrow night at 6 o'clock. It's the Vitamin University, where I'm going to go through and we're going to talk about specific conditions. We're going to be talking about digestive problems, nerve problems, restless leg, what vitamins and minerals you should have in your medicine cabinet at home, and what you should take out and literally throw away. So it's literally my 25 years of practice built on top of my dad's 50 years and my grandpa's 50 years of practice. So we've got over a century of healing coming your way that we're excited to share with you. It's a totally free event. If you'd like to participate, just make a comment in the comments below. We'll send you the link, and we're going to give this wonderful educational program about things that really help, that really make a difference and change people's lives. Because when you give the body what it needs, like so many things get better. So I'm just super excited to share this event with you. We're going to talk about ways to remember vitamins. We're going to talk about the miracle mineral. We're going to talk about a few herbs. I mean, the herb is enormous, but these are the ones that I really like. And then also we're going to talk about these signaling molecules called peptides, and how peptides literally, they knock on the door of the cell, the door opens, and literally these groceries and supplies come in, and how we can get waste products over to the liver and kidneys. And when you do that, people that are out of hope and out of time and out of options, they get their lives back and their symptoms, like they improve. By the way, it's not just me saying it. Like, you can see this on our Beyond Your Diagnosis podcast. We just had someone yesterday that couldn't move their arm, even though the x-rays, the imaging, and everything was totally normal. Can you imagine losing the focus or the functions of your arm? And then with a series of treatments, totally normal. So that's Brandy's story. We're going to talk about touch on some of the other autoimmune victories we have, that people are beating their disease all the time. We say this in the office: you're not your diagnosis. There's a person in there. If you treat the person, good things happen. So just wanted to invite you to the university, remind you there's some vitamins that people don't talk about that are so important to make the other vitamins work. Vitamin F, vitamin G, and vitamin P are a couple of those examples. Another one that really helps with lung conditions and to get over chronic infections is vitamin E2. So we'll touch about a little about where that's coming from, where you can get it in your diet, the foods that you should be eating. all in our Vitamin University event. We got a workbook that goes with it. All of that's happening tomorrow at 6 o'clock. It's free. Just make a comment. We'll send you the link. Dr. West, you're not your diagnosis. We'll see you at the Vitamin University.